Up, we'll have our next speaker through Zoom call, and this is Dr. Jessica Zdinak. With nearly half a century of behavioral science research principles and expertise, Dr. Jessica Zdinak builds trusted partnerships by providing a unique perspective as it relates to complex business dimensions, supporting rigorous scientific objectives. An Eastern Shore, Virginia native, Zdinak received her BS Psychology from Christopher Newport University, followed by an MS and PhD in Quantitative Experimental Psychology from Oklahoma State University. While attending OSU, she was awarded the Women's Research Award due to demonstration of exemplary abilities and research contributions. Jessica served as a social scientist at the National Institutes of Health, followed by Director of Applied Research and Evaluation at a consulting firm. Research program evaluation responsibilities led to the design of a one-of-a-kind U.S. e-learning curriculum that trained 7,000 plus healthcare professionals on the intimate partner violence, domestic violence prevention and response. Dedicated 5 years with the federal government sector, leading research and evaluation teams with a focus on CDC, NIH, NSF, FDA, and other large-scale grants and projects. Following public health, Dr. Zdinak spent 6 years at Altria, where she was one of 3 researchers to develop the Perception and Behavior Program. She served as lead principal scientist for first ever perceptions and behavioral intention studies, which led to the development and validation of the intentions to use scale, published in a leading scientific journal. Highly proficient with ITP, PMTA, MRTPA, as well as product innovation and future harm reduction opportunities. Award-winning publisher of foundational research and recognized for her unique research contributions, Zdinak travels worldwide as a keynote speaker to various U.S. and international conferences and forums. In 2015, Dr. Zdinak launched Applied Research and Analysis Company, LLC, as owner and chief research officer. Headquartered in Richmond, Virginia, and available for travel worldwide, teams of psychologists, statisticians, and behavioral scientists offer tailored services of unbiased integrity, exceptional client experience for government, education, business, and nicotine and tobacco harm reduction industry. So virtually, please welcome Dr. Zdinak.
Hello, that was quite the introduction. I'm so sorry I cannot be there in person, everybody. COVID finally, after all these years, hit our household. I am coming up and out of it, but now all the kids are sick. So I do apologize too. I'm still kind of recovering from that. So I really wish I could be there. I will say my dear colleague, Allison Shoemate, is there. She is our director of marketing at ARAC. So if she could just take a stand real quick. I'm unable to see you guys, which is very hard to talk into the computer screen, but please give her a hello and feel free to introduce yourself to her during the day today. So with that introduction, I'm going to go ahead and share my screen. And if you guys can, whoever is controlling the situation, let me know once this is pulled up. And I'm going to assume that it's working okay. Shahar, if you could give me another thumbs up to make sure. Perfect. All right, here we go. And I just ask whoever it is can just stop me if along the way the presentation goes away or something like that. And then normally I like to make this much more of a conversation with the audience. Obviously, I can't see you. Hopefully you can see me, but let's just wait for the conversation and questions at the end. So thank you all so much for having me. I gave a presentation several months ago of this year. And after that presentation, I was asked to come to you guys and give a similar presentation. I think it really spoke to your audience because our focus at ARAC really is the consumer and really understanding who they are. But we also come from a perspective of understanding the regulator and then scientific research. So today we're going to kind of cover all 3 of those topics. The background information, just thank you so much for those kind words. And that was a pretty long introduction. So I don't think I need to go into any more of this, but I do want to make sure it's clear to everyone that everything in this presentation is publicly available. I'm not revealing, obviously, any information that we have with our clients. And so most of the information it's going to be for educational purposes. It's going to encompass 20 years of experience within both the scientific fields that we talk about as well as industry. So as mentioned at ARAC, we are focused on behavioral science research. So we conduct, think about perception and behavior studies, longitudinal studies, randomized switching studies, all the way through to focus groups, in-depth interviews, as well as even policy analysis and program evaluation. So as mentioned, I am Jessica and I'm the Chief Research Officer. I do lead a team of statisticians, other psychologists, marketing experts, and other survey methodologists. So first, let's go cover the agenda, what we're going to talk about. First, we want to talk about our impression of why you all are here, or there, I should say. We're going to talk a lot about your target consumer. We're going to talk about how psychology can help you understand your target consumer. And then we're going to talk a little bit about why ARAC is here, our regulatory environment, how that's relevant to you all. We're then going to focus on science and the importance of science, and how at ARAC, we really take the approach of a triangle, right? So we have your consumer, we have your business, and we have the regulator. And all of those things should be encompassed together with science that will drive success for all of us. And then finally, I want to touch upon something that's very near and dear to my heart, which is saving flavors, particularly within the e-vapor space. This industry is very close to my heart. I never met my grandfather because he died of lung cancer before I was born. So switching adult smokers is near and dear to me. And I've seen way too many smokers switch because of flavors, that this is an effort that I'm really not going to give up on. All right, so let's start with the why you guys are here. Taking a step back, once we were invited here, I said, well, who is this audience, right? I think hopefully I got this right, but certainly at the end, let me know if I'm missing anyone. But you guys are there because you are a manufacturer or you're a company who either sells nicotine and tobacco products directly to consumers, right? So you are interested in making sure your consumers are happy, satisfied, and then so that they come back and continue purchasing from you. Or maybe you are a company or a manufacturer that is going to submit a PMTA to the FDA. So maybe you are, it could be large, mid-size, even small, but you're interested in doing the millions of pages that is required to submit a PMTA to get your products legally authorized to be sold in the United States. Maybe you're a company who you're just making the product and you want somebody else to then purchase the product and they handle the PMTAs. And that's all within the US, but really we should also be considered the global perspective. And so maybe you're a company or manufacturer that's looking to launch internationally, right? And so you've got different regulations and different rules to follow compared to the US. You have different political environments in the different countries in the world. But either way, all of us here, I think, are interested in selling a product, developing a product. You're interested in doing it, legally. You're interested in doing it to satisfy consumers. And so we're going to take you through kind of a little bit of a journey of if that's why you're here, how can what we provide at ARAC and how can not just us as a company, but people who do similar things as us should be part of your mission and part of your company in making sure your end user is happy and satisfied. And so I can't see anyone, but I like to do kind of a participation of how many of you, and you can raise your hand and maybe Alec can do a check mark, but how many of you have physically met with consumers as part of a research study? So you're sitting around and you're maybe in a focus group setting or whatever kind of setting you are, but you're talking one-on-one with your end user. And now there may be, I think there's a lot of retailers here at this conference. So You guys do it every single day, right? You're talking with the end user, your nicotine and tobacco consumer. It is absolutely critical for any company who wants to be successful, I would say globally, but particularly in the US with our regulatory environment, to sit down and meet with your consumer to understand their life, their needs, their wants, their roadblocks, what it is that's keeping them from maybe switching off of combustible cigarettes, or what's keeping them from using one brand versus a different brand. So knowing your consumer, it is at the foundation of product development and innovation. And it goes all the way through the process, all the way through when you're submitting an application to the FDA, and then when you're conducting even post-marketing surveillance throughout your whole regulatory relationship with the FDA. And typically when I ask this question, very, very few hands go up. And typically it's a regulatory environment. These people are so far maybe removed from the actual consumer, and this can be kind of enlightening for them to see what I'm about ready to go over when it comes to the consumer. So who is it? Let's think about worldwide first. The worldwide view, 1.3 billion tobacco users. Over 80% of them are living in low and middle income countries. Let's take a look at the US. We have about 28.3 million adults who are current cigarette smokers in the US. And on the next slide, I'm going to go over who they look like. Who are they? And you're going to see a parallel between the world view and the US view, because you have the low and middle income countries, predominantly the tobacco users in the world. And you see that that's a huge factor when it comes to our current tobacco user in the United States. I also like to take, right now, if we can all just kind of take a look at our own life, right? What is our current daily life like? Okay. Just think about that for a second. And then I'm going to give you an image, hopefully now in your head, of what your consumer's life is like. According to the CDC, 2 years ago, so some of these stats may have changed in the past 2 years, but it's been pretty consistent over time. They are from low income, as I just mentioned. So they're living in a lower income, sometimes even impoverished situation. Now this next one is more worldwide view, that there's more men than women who smoke. In the US, when we look at that, it typically is more 50-50 split. Again, taking it back to the US, they're smoking about a pack of cigarettes a day. They are between the ages of 25 to 44, and then 45 to 64 is the second highest. I will say that this is actually the first time that is the two highest groups. Typically, that is among the 18 to 24-year-olds smokers. So I think there could be a lot of discussion about why that's the case. Maybe it's the onset of e-vapor products and other alternative nicotine and tobacco products. So again, the first time that we're seeing that 25 to 44 being the highest group rather than the lower age group. They are typically non-Hispanic, non-white adult, non-Hispanic Black adults. They're going to be adults with a GED certificate, and some of them have high school degree or no degree at all. You see the percentage there. They're insured by Medicaid equally as much. They're uninsured, and they're smokers, a pack a day. So if you can also think about the economic impact and the impact in our country, that's something that I don't think is talked about enough. Almost 20% of them, they're living with a disability. We see heavier populations, I should say, percentage-wise, Midwest and South. What I also find astonishing as a psychologist are these last two. They're living with, most of them are living with some type of comorbidity or a psychological distress. When they go to their medical providers, their physicians, they're oftentimes referred to out or even internally as having depression or another type of psychological disorder. So these are not people, they're not people like me. Maybe they're not people like you. I know I'm a former smoker, but I wasn't a lot of these other things, right? So if we think about how we can't just be one of these, but we would be facing all of these different difficulties in our life. That is the adult smoker. And at ARAC, we travel, we talk to smokers, we talk to all different types of nicotine tobacco users. What's really interesting to me is you see these hurdles that they face in their life every day. But what they also tell us is one day I'm going to do it. One day I'm going to quit. One day I'm going to switch. So they have all these struggles and they're going to struggle and they try and quit over and over again, but they still hang on to the hope that they're going to be successful one day. So I think that's also really important for us to consider when we're either developing products, alternative products for them to quit off of cigarettes or, to switch off of cigarettes. So a lot of our work revolves around taking a smoker and helping them through their journey to get off of combustible cigarettes. A lot of, how to say this, a lot of people we work with, and I think in the one instance here, I do think the federal government does a better job than industry in doing this, which is using the different disciplines to understand your end user. So what I mean by that is the social and behavioral sciences and psychology is key. If you look at the PMTA guidance, for example, or the MRTPA, it is fundamental to the application. And as part of that, that is you're dealing with psychology. So how can that help you to understand your smoker or your client or your end user? So there's a hierarchy of needs. It's called Maslow's hierarchy of needs. It is fundamental in the psychology field. And the gist of it is every single human being, regardless if you're in the United States or if you're in Paris, France, or if you're in, South Africa, fundamental to the human being is this triangle. It's a hierarchy. And it basically says that the farther up the triangle you go, the harder it is they become very much more difficult to obtain. And in order to obtain it, you have to meet the factors that fall below it. Okay. So on the bottom there, you see the physiological needs. It basically says you have to be able to know you're meeting those needs if you want to move up into the safety or to the love or belonging or the esteem or self-actualization. So I love this triangle because the slides I just showed you about a smoker in the United States, I just told you that they might be struggling to eat, to find money to eat. They may be struggling to find a consistent home or place to live in or to provide for their family. So we have basic needs that are not being met by our current smoker. And yet we have a government and regulatory framework and environment that, is pushing products out of the market. That's not providing that opportunity and providing, I don't want to say accurate, I guess, perceptions of risk to the people and to the public in order for them to switch. So there they are, basically not getting their basic needs met. And yet we want them to get these needs met all the way to the top of the triangle. We want them to be able to problem solve. We want them to be able to accept facts or even listen to facts. We want them to feel that they have the confidence to switch off of cigarettes. We want them to feel like they can achieve that difficult behavior. It doesn't make any sense. They're literally worried about where their next meal is going to come from, or how they're going to feed their family, or how they're going to educate their children. And yet we want them to reach these needs all the way up at the top of the triangle. It's like we are totally away from who our current end user, our current smoker is today in the United States. So I really wish more people would take this kind of framework when we're trying to either influence behavior, understand behavior, and certainly change behavior when it comes to switching off of cigarettes. And then there's another area of psychology, very basic to the field, called operant conditioning. If you have kids, you certainly know that you probably do this and you don't even know you're doing it. Actually, I just did it this morning with my 9-year-old. So if you want to change behavior, whether that's switching off of cigarettes, whether that's switching from a different brand of products, whether that's them trying another product. Positive reinforcement works the best. So what is that? So if you look at the top, you have reinforcement in the top two buckets. You have punishment down at the bottom. You then see that there's a plus, right, up at the top, stimulus, and then a negative. So the easiest way to think about this is the first question is, do you want the behavior to increase? So do you want to see more of the behavior or less of the behavior in your client or in your end user, in your smoker or your child? So if you want more behavior to occur, you're dealing in the reinforcement side of the square, the quadrant. I want my behavior to increase. If you want the behavior to go down, you're now in punishment. Okay. You want it to go away. You want to reduce it. So the way you do that is you can either apply a stimulus or take a stimulus away. So for example, this morning, perfect example, I took away a birthday party from my daughter because she was not behaving the way she needed to behave. So I removed something that she wanted in the hopes that a different behavior would increase. So I say all this because the most effective way at changing and influencing behavior, and again, a lot of our mindset is with switching smokers, right? So taking them off of cigarettes to another product, is that positive reinforcement. So I want to increase behavior, which means I want to have them start using a white nicotine pouch. Okay. The best thing you can do to change that behavior is to give them something, apply a stimulus to make them increase the behavior or use the nicotine pouch. I'm just making sure here that everything, you guys can hear me. Okay, good. And so this is, again, something that makes me wonder when I look at the regulatory environment and even some things that industry does. What are we doing with the graphic warnings? We are actually applying a stimulus, right? So we're in the positive territory, and we are in the hopes of reducing cigarette smoking behavior. So that's actually positive punishment. And while there is some research that says positive punishment might be effective, there's actually very recent research that shows that is the most ineffective of them all, right? So these are some things that we should all be considering, whether it's industry or a regulator. So that's kind of a little bit about the consumer and how psychology can help you understand the consumer. It could help with the regulator in developing policies to, again, benefit that smoker that's trying to go away from cigarettes to an alternative product. So let's talk a little bit then about ARAC. And I know we've mentioned this earlier. We have that team of psychologists and statisticians. By definition, in our degrees, we understand, and what we do is we study people. So it's called the ABCs. We understand and study people's affect, which is really your feelings, right? So how do you feel? We study and understand people's behavior, which is what you see, right? And then cognitions, which is what you're thinking. So the ABCs, and all of those things work together to create what you see. So instead of looking at your consumer, your smoker, your customer, and only seeing their behavior, it's really important to dig deep to understand what they're thinking and what they're feeling, because I can promise you that is what is driving what you're seeing. At ARAC, we're here because we have public health experience. I have a psychologist on our team who's not here, but he was a former dean in an academic setting. So we bring in that academic perspective that we also know tobacco control and public health and the FDA is interested in. We have industry and business experience. So we understand the industry side of things. And we also understand from a business, trying to protect your business and feed your own family. And so we come at it from an unbiased scientific approach, but we understand each person's or each entity's concerns and position when we approach the different problem or business question. So getting into that a little bit now, we're going to turn into this more regulatory environment. So on the left-hand side, again, being in industry, being in business setting, I understand that sometimes your needs and wants is not aligned with your regulator. So maybe your business strategy, it's going to focus on the consumer or your customer, right? What do they need? What do they want? Are they happy? Are they satisfied? Am I giving them a product that makes them happy and satisfied? Do they keep coming back to me versus somebody else? Do they keep coming back to my brand versus someone else's brand? Well, why? That's what you guys probably are concerned about. I know me and others there concerned about switching smokers off of the combustible cigarettes to potentially less harmful, and switching them today, tomorrow, 3 months, 6 months, and that long-term strategy. Some of you want to expand your products to different markets, right? Different target audiences. It's not just about the smoker. Certainly, that's a big part of it. But what about people who just enjoy tobacco and nicotine? Shouldn't they be able to try different products, enjoy them legally? And then as a business, we should all be concerned about the reduced youth access, because there shouldn't be kids using these products. Certainly, when we talk about flavors and the youth, uptake that we saw there and some of the percentages, businesses can take a variety of different stances there. And there's different methodologies, different technologies to prevent youth access. And we work with several different companies that are doing that. And, think about the effect of flavors, right? So you're thinking about the effects of flavors on switching smokers. There needs to be the scientific evidence there, right, to support that business strategy. And the FDA still needs to see that. And luckily at ARAC, we're conducting several of those studies, and really look forward to being able to provide that scientific evidence. But, I really also hope with reduced youth access, we're all considering, and our regulatory environments considering the fact that, combustible cigarette usage is down to an all-time low, right? And I would hate for my children to use any type of nicotine and tobacco. But I'd rather them vape than smoke cigarettes like I did, because I know how hard that was to stop. And I know how horrible the combustible cigarette is. But I was still able to make that choice to use it. So that's kind of the business perspective, right? And we understand that. But at the same time, there's this regulatory environment that we are facing, and absolutely should be developing that relationship with our regulator. So we have an environment that potentially will have menthol bans, right? Flavor bans, the VLN, very low nicotine standard. We have the PMTA, the MRTPA, the substantial equivalence pathway. We have the ITPs. We now have a program of rapid surveillance that's coming out. Businesses, should be considering that, right? I know at ARAC, we're considering, well, how are we now going to balance this middle position of bringing together the regulator and bringing together the business and industry and having that unbiased, objective viewpoint, when the regulator's doing something, is industry doing it as well? Because we have to meet somewhere in the middle. That's where the truth lies. And then finally, we have a regulatory environment where there's a relatively late awareness that there's consumer risk misperceptions. It's public knowledge, but I know we presented a presentation in 2015 at SRNT, TSRC, and all we talked about was the misperceptions of risk. How on earth are we going to transition smokers off of cigarettes if they think e-vapor and pouches are just as bad as cigarettes, right? So how can we become more aligned? It's very, very important. And there's that dichotomy, and we know how difficult that is to navigate. So just covering a few of the standards. Here's what we're all facing. Here's what you might be facing. We've got the product standards to prohibit menthol. I'm not going to go through this for the sake of time, but when we look at, what the FDA has said about it, apparently when finalized, this menthol product standard is going to, quote, reduce the appeal of cigarettes, particularly to youth and young adults, decrease likelihood of non-users, decrease, cigarette consumption, and increase the likelihood of cessation. I, as a behavioral scientist, it's astonishing, honestly, to me that anybody can put out what will happen for behavior prior to the standard or prior to the stimulus occurring. So what I'm trying to say is, when finalized, there's going to be this rule, this standard that will do these things, is what's being told. How on earth do they know that that's going to happen, right? We can certainly predict, we could hope, we could, wish that that's going to happen, but unintended consequences will also occur. And, we speaking with smokers for how many years now, and, is it being considered that maybe a menthol smoker doesn't want to quit off of their cigarette? And what if they say to you, that's the only thing that wakes me up, and it's every day, and it's the only thing I look forward to because my life is that bad, right? That is the life of some smokers. And so let's consider what's going to happen if that goes away. Or what about when we hear over and over again, I'll find it. Do you know how many things that are illegal that I can find? So now what is that doing? That's opening up what I'm hearing when they say there's a black market, an illegal market. There has to be somewhere in between, and to strike that balance. It's very important that the industry, the manufacturers, the retailers work with people, work with a trusted team, and work with the regulator to come up with some type of in between here. And then we have another quote about product standards, right? So this taking away menthol and flavors, again, it's going to, right, reduce the appeal of cigars to youth and young adults. But, it's important. Let's maybe take that as a framework, but then let's drill down and find the data and the evidence. And I don't mean the data and evidence just from Truth Initiative or just from tobacco control funded studies. I mean data and evidence from unbiased, objective parties like ARAC, other industry type surveys and internal studies. Let's all get to the table and see what's happening in developing these standards. So when we think about, just as an example here, we talk about characterizing flavors, right? So the FDA has come out as a potential standard, or menthol, menthol and characterizing flavors. So, it is going to attempt to benefit public health, right, by removing the characterizing flavors. What does that mean, right? What does characterizing flavors mean? There are standards in place in other countries that we could look to for that, because being able to say in a standard what it is, characterizing flavor, is one thing, but being able to define what that really means and how to measure it is a completely different thing, right? And so it may be that states start to come down and define it for you or for us. So it's really important in this type of example that companies, manufacturers, retailers are working together, working separately with researchers to identify really what that means. Is there a standard maybe already in place somewhere else that we can start developing research programs, and working with the FDA to say, okay, you said characterizing flavors. You didn't really tell us what that meant or how to measure it, but this is what we're proposing, and here's why. And here's the precedent for that. And to be proactive, get ahead of it, before the states start to maybe take it away, or before different legal cases come to the front. So I would urge you to ask yourself, in each of these standards, but in this as an example, how can your company be proactive so that other people aren't defining it for you, but you're defining it for them? We also face the regulatory environment. We've got the standards coming down, but then we've got obviously our PMTA, our MRTPA pathways. This is an example taken from the TPPI, so Tobacco Product Perceptions and Intentions Study Guidance. This is really our meat, our bones of our company is working in the perception and behavior space. And then finally, the FDA came out, and I applaud them over and over again. This guidance was amazing. We worked with them quite a bit in advance, and I would say the FDA nailed it when it came to this guidance. I think some people thought that it came out too late, which I can understand, but I also can understand the FDA's perspective. Hire the right people to know what we mean when we say the effects of X on Y, right? As they did in the PMTA guidance. But this is just calling out how the FDA outlined how these types of studies should be done. And I thought I applaud them greatly. In that type of setting with the PMTA, in our area specifically, which is really what I can talk about, because there's many areas of the PMTA, and if you've done one, you know how rigorous the entire process is. You know, there's non-clinical testing, there's analytical testing, shelf life testing. So all sorts of different sections of the PMTA. Our area at ARAC focuses really on the perception and behavior, like I just mentioned. So this is what the FDA has asked you to address if you're applying for the PMTA authorization in that pathway. They're asking you to describe behavior. So remember what I said earlier about what psychologists, what researchers and statisticians do? They literally are outlining it in the PMTA of what we do. They want you to conduct label comprehension studies. They want you to make sure that if you're saying on there 21 plus, they want to make sure that your users seeing it and understanding it, right? Makes sense. So they want you to conduct the label comprehension, the actual use. So they want to make sure that people are using the product as it's intended, right? Certainly individuals are going to do individual things, but overall, are people understanding what you're saying? And are they using the product as it should be used? When the FDA, PMTA guidance, when they ask you to describe behavior, one of the basic principles is they want you to do qualitative research. They want you to literally provide a story to them, give them context, conduct qualitative analysis, talk to people. It's a very, I don't want to say fluffy, but it is more of a fluffy type scenario versus your kind of quantitative, hard data that comes in numbers. So that's one thing they've asked you to do. They've asked you to monitor behavior over time. In the beginning, the longitudinal study design measuring, or they basically said, they gave you a variety of different options, right, in the PMTA of what you can do to monitor behavior and to assess whether or not your product is APPH. Initially, it was very clear to me that they needed or were expecting industry to conduct experimental type studies. It is fundamental as a social psychologist, it's the first thing we do. If you want to know, do flavors affect my mood? I'm making this up. I mean, that goes to my head immediately. Okay, my variable of manipulation is flavors or not flavors. What am I going to measure? My mood. Very basic when it comes to experimental psychology. When the FDA is interested in determining the effect of something, again, whatever that is, I really hope you're dealing with people, you're dealing with researchers who understand what that means in their language. Having been in the federal government and working with them for 5 years, I understand what that means. And so if you want to demonstrate above and beyond any type of potential, noise or variability when it comes to the statistical side of things, conduct an experiment. That's what they're asking you to do. And that's the evidence they need to draw their conclusions for APPH. Just not seeing it done. So hopefully some research will start to come out that will give that information to the public. They're also asking you to predict behavior, right? That's the population modeling section. So that they are asking you to predict the likelihood that non-users are going to start using your product and that current smokers and current nicotine tobacco users are going to start using your product. But they also want to know, are people going to stop smoking completely? Are they going to stop using nicotine tobacco completely? So all of those different scenarios, the population model is a very, very intricate and time-consuming aspect of the application, but also very important. They're also asking the applicants to explain behavior, and I guess I switched those two up. Explaining behavior comes with that manipulation. when you manipulate a variable and you randomize your participants into different groups, you get a result, right? You measure a variable, mood, you get your result. And because you have set up your study the right way, you're going to be able to draw the conclusion that the only thing that's going to contribute to the mood was that manipulated variable. It is the most powerful and rigorous type of research design. And it would be really great to see more people conduct this type of work so that we can give the FDA what they're looking for. And so then kind of bringing in a little bit beyond the PMTA type psychology background, talking a little more about very specific aspects of designing your research study. So not necessarily the types of the research studies that we just covered, but more the specific aspects of that. The first thing that the FDA is looking for, they're looking for a hypothesis. Again, very basic, not really seeing it in some of the applicants, that the public knowledge that we have and information. So if you go into a study and you think that flavors help my mood, say that, right? Set up your study to test that. That's what they're looking for. That's the science behind your study. Again, that if done correctly, that's going to drive success. Appropriately design your experiments. I just went into this a little bit. Very important. Tobacco control research does this really well, but that's because they're also in a laboratory-based setting. So they have to, right? They control for all different types of confound variables, which means variables that could affect your result. They're controlling for it. But here's the thing they're not doing is they're not including the other variables that industry, retailers, manufacturers do include, because you guys are coming at it from a perspective of real life. These are real life people who come into your store or come into look for a product, and they want to know, is this product going to help me quit smoking, right? That's what tobacco control doesn't have. So it's like we're literally in this land of heads, tails. And somewhere we got to meet in the middle and be able to conduct these studies that fit both of those, right? Also, what the FDA is looking for, basic science is replication. How many times have you all heard the FDA or someone from the FDA say, reliable and robust, reliable and robust? Guys, I get it. That means replicate your study and design it correctly. And by replicate, I don't mean spend all this money on the same thing, right? And do it over and over again. Do it once, get your finding, add something else to it. So maybe add new flavors, right? Or add a new form. And now you're replicating, but maybe you're also bridging, right? So come up with this long-term big strategy so that you're not throwing all your resources into, a $2 million switching study this year and next year, right? Replication, that also shows the agency that it's not an effect that's happening just one time, but over and over again. The other point here I think is very important is don't create survey questions, willy-nilly. There are many reliable and valid questions, survey scales, measures that are out there that should be used. And they should be used because the FDA is looking for you to make sure the responses and data you're getting from your studies mean what you think they mean. So if you say you're measuring mood and you create the questions, I can almost guarantee you're not measuring mood. You're probably measuring something else. There's a whole field in psychology of psychometrics. And what they do is literally assess whether or not the questions you create are measuring what you think they're measuring. And then it also says, okay, is it measuring that within men and women or just women, right? So there's a whole field there. So make sure you're using these types of scales. And then finally, I like to close with just, this plug for saving flavors. There's too much data out there Unfortunately, it's, stuff that either can't be shared or just in different kind of aspects or different stages of the research. But there's too much out there to see flavors go away, that I'm going to tell you it's going to hurt public health. It will harm people. It will harm public health. People will go back to smoking combustible cigarettes when it comes to flavored e-vapor products. So how do we save flavors? I think, first is, like I just mentioned, we got to design the appropriate study. And there has to be specific questions that we know the FDA is looking for, whether it's from application feedback or the PMTA guidance or conversations with them. They, and I wholeheartedly believe this, and really hope that I'm not found to be naive in this one day, but they are looking for the appropriate scientific evidence. If they continue to say that after it's put out there is going to be some questioning, but I don't know, and I don't think that it's really been put out there yet. So designing the appropriate study to answer the specific questions is very important. Getting external support, getting your team of trusted advisors who can kind of develop the strategy with you, that makes sure you're not throwing resources, like I said, 1 year and then you're throwing it out again. Because we all know that resources are becoming more and more limited as products are becoming more and more taken off the market, or put on, the red list, or being cracked down from the FDA. Money's then going away, right? So how on earth are you going to be able to afford this type of these types of research studies when the FDA is coming and taking you away? And from the FDA's perspective, they're saying, well, you're not giving us the data and evidence. Well, how can they give you the data and evidence if you're taking them off the market and now they don't have the money? And so, part of me does start to wonder, where are we going to land, right? Are we going to land with just two big players with products on the market, and everybody else who's trying to do the right thing and wants to do the regulatory pathway, are they going to be taken off for good and never be put on the market? So make sure you have that external support that's going to have those tough conversations with you. And that's going to conduct the research. That's not just going to blow your resources out, but it's going to really be on your team. It's also very important, if we want to save flavors, we got to engage with the FDA. They are people too. Develop a relationship with them. And maybe I feel this way because I was in there for so long. Not so long, 5 years is not long. But I saw their perspective. And I think that's really important, that we kind of learn that empathetic approach for both sides, right? Be proactive. And part of this is the technology. There's so much technology out there now. And some of it is like way too much. We don't even know where to begin. Again, get that trusted advisor, get that trusted scientific team, and make sure it's not just someone who's looking for the next cut of money for a research study, but that truly cares about the work that you're doing, because technology can help save this, but there's a lot to it. And hopefully, if you're in that area and you've been researching it, looking into it, that it's not going to be as easy as flipping on a switch and saying, hey, I can now verify an ID. There's a lot more to it. And certainly doing your due diligence. The companies that are doing their due diligence, trying to put the applications and trying to do the research studies and do it the right way. If there was a way that, the FDA could kind of treat them differently than those who are, whether it's illicit products coming in, mimicking other brands, taking the time to say, hey, is this that product, or is this actually an illegal product that this company who's really trying to do it legally, they're now looking bad because it's coming in, from overseas, and it's coming in illegally. We've got a big problem there. And then I didn't put it on here, but we got to start sharing data. We have got to start sharing data. If it's a business strategy approach, I understand why some data is not being shared. Totally get it. But if we are here to transition smokers off of combustible cigarettes, which is what we say, a lot of us are here to do, or we're here to please a consumer, we're here to please a customer, then let's talk to them and find out what they want. And in doing that, I'm telling you, they want flavors. And I know there's so many people maybe there that I know and that have been saying the same thing as as I am now, because you guys hear it. You hear it every day. So it's very difficult to be in a situation where you hear your customers' needs, you hear their wants, but then you're facing a regulator that's trying to take it away. So what do we do, right? How do we join forces? I think that's really important for us all to come together that have that mutual understanding and mutual goal. So in summary, I think the first thing we can all do, whether we're the regulator, we're the retailer, we're the product developer, we're the VP of a large firm, learn empathy. Likely you're not your consumer, so let them lead your company, right? And let them help you develop products. And in developing products, don't think about today. We need to be thinking about tomorrow and past tomorrow. And that means thinking about our regulator and where their mindset and framework is going. It's also very important to just understand and build these relationships with your regulator and your team. So who do you have in your team, whether that's internal or external? It's very important to make sure you have people you trust. You have people who know the science, are being driven to support you with science in order to drive success for your company. And that success is, it's the right research, it's at the right time, and it's with the right team. And sometimes those things can be difficult to identify and define. So, we are here, certainly would love to chat with you, even just about sharing, how important it is to understand your customer, your smoker, and just becoming empathetic with their needs and wants, while also maintaining that integrity with our regulator. And so with that, because of this screen, I have no idea how much time that is, but I just want to thank you all and apologize again. I think my voice is getting ready to go. But certainly please look out for Allison. She is there. And we will be at TSRC and GTNF and other places over the next several months. And so hope to see you guys there. And enjoy the rest of the conference. All right, I don't know. I'm going to say stop sharing so I can maybe see everybody. I don't know if there's any questions or comments or discussion.
Dr. Jessica, can you hear me? Okay, so
yes,
she can hear us. Allison will be at the booth, so we can have her handle most of those questions. But if anybody's got an immediate question they want to ask, we can keep Dr. Jessica on for a couple more minutes. Otherwise, they will have the booth. Allison will be working that. She can provide Dr. Jessica's information. So thank you very much, Doctor. We'll let you go and hope you feel better. Okay. Thanks for your time.
Thank you so much. Y'all have fun. Bye-bye.
Have you ever felt frustrated with the people around you?